The CAT scan is a medical procedure in which a specialized X-ray provides a cross-sectional image of the body. A patient lies inside a tunnel equipped with a scanner. The scanner consists of an X-ray emitter 180 degrees across from the receiver. The patient's bed slowly moves through the tunnel and stops. The scanner circles the patient, and X-rays are beamed and received at many points along the circumference of the tunnel. Each time the bed moves, the scanner circles again. A computer analyzes the information received by the X-rays and constructs an image of a slice of the body.
This advanced imaging tool will help physicians diagnose and pinpoint heart attacks and strokes. Computed tomography has been around for years, and just a few years back, the gold standard in this technology was the 16-slice CT scanner. Now, the state-of-the-art multi-slice technology is the 64-slice CT scanner, and it's making a big difference for Ochsner physicians when it comes to taking pictures of the heart and arteries. Unlike an angiogram, the CT scanning procedure is non-invasive.
Well, the risk of an angiogram is relatively low, but the possible complications are significant. Bleeding is the most important thing we worry about. Rarely people may need blood transfusions or a procedure to stop the bleeding. The 64-slice scanner is a completely non-invasive procedure. We place an IV in the vein, and so there's no significant risk of bleeding. You'll need a Band-Aid after the procedure. There's no significant bleeding problems. And so we can get this CT scan and take a look at these pulmonary veins and tell our electrophysiologists how big they are.
The 64 slice is so fast and accurate, it has the ability to image the heart while it's beating, precisely producing diagnostic pictures within 5 to 10 seconds.
Each time the computer, the X-ray equipment is spinning around the body, it's collecting 64 slices of data each time. The analogy is when you're trying to take pictures of your kids or your dog and they're running around, and every time you look at the picture and it's blurry, 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 maybe one picture is good. A flash can help stop that action, or for photographers, faster shutter speed or faster film is able to stop that action. That's sort of what we're doing with 64 slice data. By trying to capture more of that information each sweep around, we can try and freeze the motion of the heart.
The entire procedure takes about 20 minutes, and once the CT scan is complete, the patient can leave the hospital. Dr. Riley says while the invasive angiogram can show physicians where there are blockages in the artery of the heart, the blockage is only seen after there is quite a bit of plaque buildup.
64 slice CT scan, because it doesn't just look at just the artery, because it's showing us the whole heart, and in fact showing us the walls of the artery itself, we can see the very beginnings of plaque, maybe even before it would show up on invasive angiogram.
Besides the benefit of early intervention with cardio patients,
you can see there's not any narrowings here of this artery here.
Dr. Riley says this multi-slice imaging device can also accurately indicate when a patient is out of danger.
The real strength of the cardiac CT, the multi-slice CT scan of the heart, is in predicting who is normal, and telling us who's normal. We call that the negative predictive value.
The 256 slice multi-detector CT scan is the latest innovation of scanners, with advanced features that effectively analyzes and diagnoses the heart and coronary artery conditions. The 256 advantage, accurately mapping high-resolution images of voluntary contracting organs, such as the heart, capability 70+ beats per minute. Critical for early detection of possible artery obstruction, including calcium salt volumes. Minimal risk for artery catheter insertions. Increased rate of scan movement at 0.27 seconds per cycle